This conference will now be recorded.
Yeah. So that was that. And Herb, it's 6:04. I suspect
Right.
you're going to get a bunch more people. So let's just talk. Mr. R, how are you?
Right. Well, we're recording now. Somebody turned on the recording.
You don't
Yeah.
want.
This conference
that's
will now be
because-
recorded.
There you go.
Great. So this is the blood cancer group of AnCan, and we welcome everybody. And the procedure here is we'll ask each person whether they need some time. But before they do that, we have a newcomer, Kathy Ferguson. And so, Kathy, we'll begin. Why don't you tell?
You went off a little bit, but I think you asked me for what my story is, basically.
Yeah, basically, tell us about.
So I live in Boston. In 2013, I was diagnosed with CLL, and I was in watch and wait. And while I was in watch and wait in 2018, I had Richter's transformation to Hodgkin's lymphoma. So I did 6 months of ABVD chemo for that, and that's been in remission since then. And my CLL started raging a little over a year ago, and I started on the AVO trial. So acalabrutinib, venetoclax, and obinutuzumab. And I just started cycle 12 of that this Tuesday. Hopefully going out to cycle 16, and if there's minimal residual disease at that point, I can stop treatment and be monitored. If it's still there at that point, either in the bone marrow biopsies, the peripheral blood, or the scans, then I will go out to 2 years. And if it's still there at that point, I can stay on it, indefinitely, as long as it's still working. So it's been a rough, little patch there.
Right.
Between the Richters and then starting treatment again. But I actually feel pretty good. I've been anemic. I've been, dealing with neutropenia the whole time. I've had Neulasta basically every 2 weeks the whole way through treatment. But other than that, I've tolerated it really well. And my scans and bone marrow, I started out at 97% in the bone marrow with leukemic cells, and I'm down to, I think the last one was like 0.87 or something like that.
Great.
So it's helping.
Catherine, what were your markers?
Excuse me?
What were your markers? Like I'm 13q.
Oh, I have really bad, really bad high risk genetics. I have 17p. I have unmutated. I have TP53. I have all the bad stuff.
Yeah. Buy some lottery tickets, right?
So that's why I went on the AVO, because I see Dr. Jennifer Brown at CLL, who's the CLL director there at Dana-Farber, and she thought this would be the best thing given all my genetics that I have. That's, for high risk. So hoping for the best, and if not, then, we'll try something else. But so far it's been great. They're happy with where I am at. I'm happy with where I'm at. Hoping for May to come and be able to just stop treatment. That was the ultimate goal.
Well, you look good. You look
Yeah,
healthy.
you look great.
I feel pretty good, like I said, other than I've been anemic most of the time, but we're not even sure that that's related to the CLL or if it's just been something that's been kind of been ongoing off and on since I had the Hodgkin's in 2008.
So how old are you, Kathy? How old are you?
I just turned 62.
Okay.
So I was diagnosed when I was 53.
Wow.
So it's been going now for almost 10 years. And then, like I said, I was 5 years in. They told me when I was diagnosed, I had like a 3 to 5% chance of Richter's. And almost 5 years in exactly, I transformed. And I haven't even had treatment yet at that point. So it transformed before I even had any treatment. Fortunately, it was Hodgkin, so they consider me cured at this point, potentially. They're not going to ever say that, but my Dr. Brown has told me that she considers that I'm likely cured at this point from that.
Well,
So
it's nice at least that they use the C word, but in multiple myeloma, they never use it because they say it is totally uncurable.
Right. Well, that's what they say about the CLL too. But if you can get into long-term remissions, to me, that's my ultimate goal.
Right. I mean, the point is to just get into a situation where it just is in the background,
It's
Right.
stable, chronic.
stable. I mean, although Sally, that I have heard people these days talk about cure for MM.
We're looking for it in 5 years because there
try.
are people who have been in full remission for 20, 25 years. But
Right.
even the specialists say they can't say it for certain, even with MRD testing now down to the 10 to the -6,
Hmm.
you know, there's still can be 1/10%
Right.
of something
Well,
out there.
right. So Kathy, do you have any, any questions for Kathy of the group? And you had the most
Oh, and by the
insight.
way, I just got Evusheld 2 weeks ago. It was no side effects whatsoever at all.
Fantastic.
Oh,
Yes.
Was it hard to get?
Yeah, Dana-Farber is like really, they have the leukemia lymphoma floor that I'm on, 75% of the patients qualify and they only have enough Evusheld for less than 1% of their patients.
Wow.
But given the fact that I've been on treatment for a year and I've been on obinutuzumab and the venetoclax and I had 3 vaccines and I still had no antibodies whatsoever, their priority at Dana-Farber is for people like that. And then you have to get your antibodies tested before they give it and you have to have less than 300. Of course, I was, negative. I didn't have any. So it's very, very difficult to get. In Massachusetts, especially with all the hospitals we have here, it's just, people are scrambling for it. I was very fortunate to get it.
My antibodies went from 126, the first vaccine, to 225 to the second vaccine, to 2,600 with the booster.
Nice.
Wow.
Oh, right.
Yeah,
So I'm happy with that.
yeah. I had
Now-
all 3 and I still had 0.
Have any of you been told to get the 4th vaccine? Because I had my follow-up with my CLL specialist in January, and she said no decision yet. She didn't feel, and this is University of Pennsylvania, she didn't feel that the study from Israel, which was less than 200 patients, that there was enough data to make that decision, but that the group of specialists were going to meet and make a decision, but I haven't heard anything yet.
Yeah, I mean,
My doctor must have been talking to yours because mine says don't take it yet. There's not enough information.
right. The Israeli data did not show that big an increase with the 4th booster. It was clear. However, I will say, Sally, my brother got a 4th booster.
Good.
Guess it couldn't hurt, but
Right. I mean, he's being treated at Hopkins.
mm.
Well, and I'm in California, so that's, 3,000
Right.
miles of difference.
Yeah.
But I also read that pharmacies are turning people away that are coming in for the 4th booster because
We
there's
don't
not
tell them.
information out there.
Yeah, you don't tell them.
Yeah. Oh, you don't tell 'em. You have your card. My card has 3 dots on it. Around that. I'll just wait.
So Kathy, do you have any questions for us?
No, I was just, like I said, Michelle's asked me a few times to come on. I first met Michele at Dana-Farber way back when, but Thursday nights are tough for me, but tonight I told her, she messaged me again last night and told me about it, and I said, oh, I got it in my reminder in my phone, so.
No, we're glad to have you, and please continue to come back.
Thank you.
And I think hopefully Michele will join us next time.
Uh-huh.
So, Sally, maybe do you know, is anybody else new here tonight?
No.
Okay, so why don't we go
Unless
around?
Judy is. I don't know who Judy is.
Okay. Why don't we wait for Judy, and we'll see who she is.
Come in.
Let me bring these boxes in for you.
Oh, yeah, please.
Mm.
Thank you.
I just joined.
Oh, hi, Judy. Is this your first time with us tonight?
Yes.
Okay.
Oh, thank you, Patrick.
Welcome to AnCan. So is the custom of our group to give new people priority in terms of explaining, talking to us and introducing themselves. So again, I don't know, you didn't hear Kathy, who's new, but Judy, why don't you tell us a little bit about you, yourself, how old you are, and your disease situation.
I am 74 years old. I was diagnosed with CLL in 2014. 2015, I had BR. I was in remission for 3.5 years, and then had large B-cell lymphoma that I was treated with REPOC for 6 rounds plus venetoclax, and am currently in remission for 2 years.
Mm-hmm. So your current status is in remission from
Yes.
both.
Yes.
And
Nice.
where do you live and where are you being treated?
In Frisco, Texas at UT Southwestern with Dr. Awan.
Uh-huh. So, Kathy, do you have any questions for Judy? I mean, you sound like you're closely related here.
I was diagnosed, Judy, in 2013 with CLL, and then I had Richter's.
Well,
So
that's what
Hodgkin.
mine is, Richter's.
Yeah, I was switched to Hodgkin's, which is pretty rare, but fortunately for me, you know, it worked out. So,
What were
did you
you?
have treatment before you transformed?
I'm sorry?
Did you have treatment before you transformed?
Yes, I had BR in 2015. I had
Okay.
6 rounds of it. Yeah,
So what
and
about
then
your,
go ahead.
what about genetics? Did they do any genetic testing on you?
Yes, and there's no genetics problem.
Uh-huh.
Judy,
No trans,
what were your symptoms? Like, did you have fatigue? I'm curious as to, because I've read, I have CLL also, that some individuals that go into remission, they say that some of the symptoms that they had while they were either in watch and wait or being treated really didn't go away, such as the fatigue. Did you see a big difference?
Well, when I was first diagnosed, it was just from a routine blood test, like most people are. And then that was in December, and in October of the next year, I had like an egg-sized lump under my arm. Really didn't have any other symptoms that I was aware of. And they did all kinds of testing. I was with just a general oncologist, and at that point, he referred me to UT Southwestern, which I went to. One doctor, which I really liked, and she treated me with the bendamustine Rituxan, and went in remission with it. And then from that, after the remission, then I had like a colonoscopy in November and of 2018, and in 2019, in about April, I said to her, I said, you know, between the blood test and just losing weight and some other things, I asked her to restage me and get the fish test and the it's the other test to do. And then in June, actually in August of that year, then I had a PET scan, and that's when they found like a glowing in my colon of like a 30, which is very high. And so she had me do an emergency colonoscopy, and I had the large B-cell lymphoma was in the colon. It was not colon cancer, but it was in the colon, and I had half of my colon removed.
Wow.
And then 2 weeks after that started the REPOC. And then the first 3 rounds of REPOC, I didn't have venetoclax, but the last 3, she transferred me to Dr. Awan, who had come from Ohio as a CLL specialist, and I had met through our CLL support group here in Dallas-Fort Worth area, and knew of him. And so I asked her to consult with him, and that's when she said, why don't you just turn your care over to him, which I did. And he added the venetoclax for the last 3 deals. Plus after I finished in January of 2020. And then in February of 2020, he also gave me methotrexate, 2 infusions of it to keep it from migrating to the brain.
Mhm.
They never found any cells in my, the spinal fluid, but he did it as a precautionary.
Good.
And then I had a spot on my lung, which they wanted to make sure. So I had a lung section taken out in March of that year, and it was benign. It was nothing to be concerned about. So, but we did it under precaution because with Richter's, you never know.
Great.
And now currently I'm in which I will meet with tomorrow, a pancreatic study because there are lesions which he's not concerned about on my pancreas. So I'm in a pancreatic study.
Quite a journey.
Yeah, but I'm doing okay. I mean, I feel okay.
So Judy, how did you hear about us?
Michele Baker posted something on Facebook today.
So do we have your email address so we can keep you on our mailing list? The same thing for you, Catherine.
I don't think you have my email, no.
So if you would do me a favor and put it in the chat window. Do you know there's a chat window in the upper right-hand corner, that little symbol?
Oh, yeah.
If you would be so kind as to give us your email address, I will make sure you get announcements of future meetings and other information out of AnCan.
I'm on an iPad, so I don't see the chat.
Okay. So why don't you just say your email? I mean, let's see if I have it. Oh, there it is. There's Catherine's.
Yeah, I just sent mine to you guys.
Right. So Judy, what is, just if you recite it, I can copy it down.
Oh, wait, maybe I do see the chat now.
So Judy, do you have any
I can get it to come up. No, I just saw it and thought it sounded interesting, so I thought I'm one of the facilitators for the CLL Society support group in the Dallas-Fort Worth area.
Okay. So are any other questions for Judy? Anybody? Comments, questions?
Well, here I come. Now I can put my email.
So I had one other question, which is there's a drug which I had not heard of, Catherine. Evusheld, did I say it right?
You did. Evusheld is what I call it, and that's what they called it, but EVUSHELD.
Yeah. EVUSH. Oh, for COVID.
Yeah, so it's for COVID, for those of us that don't make any antibodies. It's a lot of immune compromised people, but the highest priority right now, usually in
Yes.
general, is for people that have been on like BCL inhibitors type of things,
Right.
that
So are
don't
these
respond to the
antibodies?
vaccines.
Are
Excuse
these
me?
antibodies?
I'm
or
scheduled to get it
antivirals?
Yes,
next
the
week.
monoclonal antibodies, it's a combination of two different ones. They found it to be, it was highly effective against Delta. It is still effective against Omicron, but it has reduced efficacy against Omicron, but still effective against it.
Right. So I take it if that it's not the Regeneron antibody, which has
No.
been pulled.
No.
This
So this is a
is
brand new
for
one. It was given
before your,
EUA in December of 2020. Strictly for people that either cannot be vaccinated due to a history of bad
Right.
vaccine reactions
Got it.
or highly immune compromised that don't respond to vaccines. That's the
Uh-huh.
and
only
it's
people
for,
approved for.
it's, you also can't get
Prophylactic.
it if you've been exposed. I'm
Yes.
supposed to get it next week.
Mhm.
You can't have
Interesting.
COVID and you can't have any exposure for 14 days. And it's
Right.
given
Right.
prophylactically to prevent severe disease if you were to get COVID.
Yeah.
Okay. Wow. Okay. That's interesting information. Thanks for sharing.
Uh-huh.
So, given that, why don't I ask our other participants whether they need some time tonight, and then we can see how we're doing. Sally, do you need some time tonight? No. Al, would you like some time tonight?
I just have a question. So yeah, a couple minutes.
Okay, no problem. Anne, would you like some time tonight?
No, I'm good.
Jim, would you like some time tonight?
Yes, anyway, I have a sort of a strange story which I think could apply to all of us.
Okay. Seth, would you like some time tonight?
No, thanks. I'm okay.
Okay, good. Ashley, would you like some time tonight?
No, I'm okay. Thank you.
Good. And we have a new person joining us, Lynn, and I don't know if she's new to the group or new to AnCan. Sally, do you have a sense?
I'm not new.
Okay. She was here last month.
Okay, Lynn, would you like some time tonight?
No, I'm good.
Okay. So, and I actually will take some time tonight. So, and give you a report on my brother with multiple myeloma. So, Al, you have a question.
Yeah. I've asked my doctors this, and I wanted to just to do like, ask you guys, does it make a difference? And when do you prefer to take your medication, at night or in the morning?
I mean, for certain medications, it makes a big difference, right? I mean, things like steroids should be taken in the morning. Things that have there are certain hormones that are naturally have a diurnal rhythm. And so you want to try to match the diurnal rhythm of the hormone when it's high and low when you're taking it. So for example, like steroids, thyroxine isn't a morning drug because your thyroid hormone goes up in the morning. But others, and then other people say, for example, blood pressure medication works better at night. I'm not so sure that's a hard and fast rule. Anybody have other comments? Jim, you were nodding.
Yeah, so hypertension, anyway, I find to be the best, okay, overnight, okay, because during the day, okay, I have found that it really isn't a big issue. At night, it is, and it has been.
Anybody else have it? Seth, when do you take your drugs? You're muted.
Sorry. I take just about everything in the morning with my pomalidomide I take before bed.
Anybody else have sense of when they take their drugs?
I
I
take,
take them all day long.
yeah, I was gonna say, I take them all day long, but, my Revlimid I take at night because it makes me sleepy, so it's a good sleep help. But things like aciclovir and things like that, I have to take twice a day, so I take them both. Everything
Yeah,
else
I
I
take
sort of
that
split
3
up.
times a day.
Yeah, I have to take acyclovir twice a day. I take it in the evening as well.
I will say this though, I used to take venetoclax in the morning and I was having a really hard time with it with nausea. And they told me I could switch it to at nighttime because at nighttime, you know, you're going to bed after you take it. So since I switched it to nighttime, it's been fine, no issues whatsoever. Because it's usually like a few hours after I take it, I was getting really nauseous. Since I've been taking it at night, it's 1,000 times better.
So how long have you been taking venetoclax?
I just started cycle 12. I've been on the AVO trial since just about a year ago. So acalabrutinib, venetoclax, and obinutuzumab. So I've been
I
on
was
it
gonna
almost a year.
They took me off acalabrutinib because my neutrophils went too low.
Oh yeah, mine have been, I just was talking about this earlier. I've been getting Neulasta like every couple of weeks. But they think I might have a chip with my neutrophils also, which, you know, so they don't effectively work that well. That's why I said I got the bad genetics.
So Al, which drugs do you take that you think you might want to move?
I take a hydroxyurea, and it's
Uh-huh.
to slow down my mutation of platelets in red and white blood cells.
Mhm.
I'm dealing with a polycythemia vera.
Mm-hmm.
And I had an appointment with my primary care doctor, and I was explaining to him some of the symptoms. And he says it's probably due to the medication I'm taking. They're not real bad. I can tolerate it, but it's always been in the back of my mind because, you know, I've always heard of people taking medicines at nighttime because that's when your body's, you know, juicing everything up.
I take them. I mean, I take my. I mean, I can't imagine how many pills I'm taking. It's just unbelievable. But you know, but I take thyroxine in the morning, my statin in the morning, vitamin B in the morning, my steroid in the morning, and then at night, my hormone therapy and my anti-androgens and my antihypertensives. So yeah, I think it depends on. I mean, hypertension I think better at night, but I don't know about hydroxyurea.
Yeah.
Certainly look that up whether there's a preferred time.
Yeah. And again, you know, I just wanted to do a quick survey on, you know, what other people, other
Well,
patients.
what are the symptoms you're getting that you find annoying?
I get some nausea, fatigue. But again, it comes with what I'm dealing with, my disease. So.
Right, but again, if you were allowed to take it at night, if it would work at night,
Yeah.
it's heard that maybe if that nausea and fatigue, when you're sleeping, may not be so terrible.
Yeah, that's exactly what I was thinking. But again, I just wanted to get everybody else's input.
Mm-hmm.
University of Health in Michigan State says to take it once a day at the same time during the day, doesn't matter morning or night, with or without food. So I think Al or Herb's idea of taking it at night is an excellent one.
Yeah, and
mimic what Catherine's doing.
Mm-hmm. Yep.
Right. I mean, I think the idea is just to try to minimize whatever the negative symptoms might be.
Right. Yeah. Mm-hmm. And that I have discussed with my doctors, and they said the same thing. But again,
So,
you know.
So I'm taking this one right before I go to bed because you have to have an empty stomach for 2 hours, and it stops me from munching at night. I know after 9, no more food. So that's my little, that was sort of the way I decided to take that. I knew it would stop my munching. So, okay, we'll move on. Jim, you said you had something to share with us.
Yeah, a sort of a story. Anyway, I have the prostate cancer. Okay, and so anyway, I've been on these drugs to suppress the testosterone now for about 4.5 years. Okay, and they say that you will gain pounds. Okay, and occasionally, and the thing I'll do is to gain 10, I'll lose 5, etc. Well, come about Christmas time, I decided that's it. I am going to lose a bunch of pounds. So, and anyway, I started this thing that you eat no more than 2,000 calories a day. Okay, and it worked. Okay, I started to drop weight, except for the fact that I was fatigued. I mean, I was really fatigued. I felt like I was like 100 years old. Well, the catch is within a monthly schedule, I get about 7 of the blood tests, and there was a blood test which will measure the potassium, okay, and the potassium tanked. I mean, it was way down because of the food choices I had.
You're not eating enough bananas. You need bananas.
That's true. Okay, the bananas and the potatoes and the broccoli and all that stuff. All of a sudden, anyway, I got real smart on that. So I am still on it, and I'm down like 16 pounds in a month and a half.
Wow.
And it is good.
Jim, I can only wish I could do that. I mean, if I'd have to, for me to lose weight, I have to be down at like 1,100 calories a day,
oh, no.
which I find very hard to do.
Yes, it is. But so far, anyway, the stomach, I guess, has shrunk enough that I'm not that hungry. And the thing I will sneak occasionally is a chocolate chip cookie. I'll be bad that day, but okay. Other than that, things are great.
That's great. Anybody else have any sense of weight loss or gain? I mean, certainly I'll share with Jim, since I was on the same drugs he's on, I've gained about 20 pounds. Now, luckily, I was extremely thin before all that. So, and now I sort of look normal, but I still feel fat.
So are you taking the oral or the shot for the prostate?
Yes and yes.
Right.
Because
yes
my husband takes the shot every 6 months.
Right. So does he have a problem with weight gain with it, or?
No, not at all. But he's also developed Parkinson's, which has regimented our eating immensely because he has to take his medicine at 7, 12, and 5 and eat at 8, 1, and 6, which really messes up. We've never been that regimented before.
Interesting.
Judy,
yes.
you should get him to join us, okay, AnCan wise. Please do.
He's listening over in the chair in his recliner.
So we have several groups for prostate cancer patients meeting quite often. And so if you go to the AnCan website, he can find when we're next meeting, depending on what his state of his disease is.
Well, he just had a blood test yesterday, and we'll meet with the doctor. We're in Texas under ice, so he's meeting on webinar
Right.
tomorrow with the doctor.
So is his doc
But
also at Southwestern?
Prior to going to this new doctor, he was, yes.
Mm-hmm.
We've moved all of our doctors to UT Southwestern.
So is he seeing a prostate cancer specialist?
Yes, Kevin Courtney. He was seeing a doctor in Arlington that he had seen since 2009, and we didn't want to drive all the way from Frisco to Arlington, so we asked him, and he recommended, as well as our primary care recommended, Kevin Courtney at UT Southwestern.
Mm-hmm. Right. Well, that's probably a good choice.
And before the one in Arlington, he was only taking the shot like maybe once a year, and he would not get it until the PSA started going up. But Courtney wanted to keep that under control.
Right.
He didn't want it to fluctuate.
Absolutely. I mean, if you're taking Lupron or some other drug which is supposed to keep your testosterone down.
Lupron is what he's taking.
Well, we'll see.
He takes the Lupron every 6 months.
Right. I mean, the other part of it is I'm switching gears here to the prostate cancer field. Most people think that 6 months is too long.
Yes.
That in fact,
he had been going a year. The 6 months is really not too long, I don't think.
Yes, it probably is. And what we find from the literature is that even at the tail end of 6 months, the PSA testosterone starts to rise. That it's not really effective for that long. You can't. It's a depot injection, and it has certain life. So I think he really needs to talk to his doc about. Right. Okay. He should join our group, and we can help him out there.
Well, he's been doing okay since the deal.
Okay.
He also had the 40 radiation treatments back in 2016.
Well, I think that, Judy, I think we'd really welcome him into our prostate cancer group, where I think he could learn a lot. And it's sharing, just like we're sharing here, but again, all about prostate. So I think that's the appropriate forum for him. And we hope he can join us. And he'll
Absolutely.
be certainly.
We'll see if we can find it.
It's ancan.org website, and then depending on his level of cancer, he can join either the advanced or the intermediate group to discuss.
He's really
cancer.
He's really, I guess, in the intermediate or whatever. I mean, he really doesn't have any symptoms or anything.
Right. So I think the intermediate, or he could bop into the advanced, and we can direct him, which the advanced group meets every week. It will meet next Monday at 8. So.
Okay.
And so Sally.
8 Central? 8 Central or?
8 Eastern, 8 Eastern. Same time as here.
No, I'm in Central.
Right, so it would be 7 Central.
7.
Hi, interesting enough, Judy. Let's see, I had it for, I believe, close to 3 years, and there were no symptoms at all. None. And then anyway, I was stage 4 at the time. So,
So Jim, I think we ought to have her husband join us, and since this is the blood cancer group,
yes,
Yeah, right.
and he'll be welcome in the prostate cancer group.
Okay,
So,
we'll try to.
so I don't have all the numbers. So I mean, Sally knows that my brother was diagnosed with multiple myeloma in late last year, and he's been treated at Hopkins and with the 4-drug combination, DVRD. And it really brought his numbers down, but when they did an MRD, it was not to the level of which they were hoping. It was not completely gone. So he is scheduled for a transplant. However, Hopkins is not doing any autologous stem cell transplants because of COVID.
You're kidding.
So,
Everybody else seems to be.
Yeah,
but so he's sort of just waiting.
they're
Well,
still doing it at UT.
they're still doing a City of Hope and Cedars in
Right.
California.
Huh. Well, you know, Maryland is really pretty damn strict about COVID, and it's going down, and it's heading down. I mean, if you look at the numbers, we're lower than almost anybody else in the country in terms of current cases. So they've been really shutting down things just in order to not transmit. So he's stuck, but he's not a happy camper. I'll tell you that.
I hope he's still in consolidation with the 4-drug
Yeah.
treatments.
Yes, he's still he's still getting
Because his
treatment.
numbers can go up very, very quickly if he stops.
Uh-huh. So yeah, he's getting his treatment. No, he's not stopping. But I mean, originally they said, you know, if his MRD came back okay, then it would be a toss up whether he would need a transplant or not.
There's two theories of thought, and I'll jump to the conclusion first. The PFS or progression-free survival isn't any different whether you have a stem cell transplant today or a year from today. But it's just whether or not you want to be on a 4-drug regimen for two years and then have a stem cell transplant and go on maintenance, or go ahead and have the stem cell transplant, go on maintenance, and in 2 years stop maintenance.
Right. Well, I think in his case also, you know, it's he's 75.
I had mine on my 75th birthday 3 years ago.
But you know, the older you get, the higher the probability is something else is going to get in the way.
Yeah, but you won't pass the EKG or the pulmonary.
Right. So
I would suggest he go to another hospital and get it done.
Okay. I mean,
My personal opinion.
Yeah, I mean, we do have a connection at Penn.
Yeah. Because like I say, I did mine on my 75th birthday, and the transplant itself was a piece of cake. It was more boredom than anything else. But the recovery took 6 weeks. I mean, I could not do anything for about a month.
But he's been told that he sort of has to stay in isolation for at least 3 weeks.
Well, I've stayed in isolation for 100 days.
100
Not
days
isolation, but quarantine at home. Yeah.
Well, right, but they'd say he's got to be somewhere under strict quarantine at least for the first 3 weeks.
Well, that's totally different. I went home on day 12 and was at home on the day after my transplant with my cats and dogs and everything else.
Okay, that's interesting.
And I'm MRD
I had
negative.
a friend that just had it at MD Anderson, and he had it in November and was back at home before Christmas, and just went back for his 100th day, and it's doing great.
Seth, what do you think?
My experience was that 100 days sort of rings a bell now. I can't remember exactly, but I didn't go home right after I got my transplant. I was in hospital for 3 weeks afterwards before I
Yeah,
left.
that's what he was told, right?
And then, I guess it was more of isolation or quarantine.
Quarantine, yeah.
But
Quarantine.
it wasn't, I just imagine it's much more strict because of COVID now.
Yeah, that's it.
Yeah, back then I was wearing a mask and,
That's
you know,
the hot.
and people would see me walking with a mask and they were worried that I was contagious. They didn't know that I was a precursor.
I wore a mask way before COVID ever started.
Yeah.
I've been I've been in quote quarantine for 3 years because I got out of rehab after I had my knee surgery the day we shut down for COVID, and I haven't been out since.
Wow.
I've gone to lunch, but I haven't done what I
But
normally
Seth,
do.
did you leave the house in those 3 months, or did you stay home?
In the 3 months after my stem cell transplant, I went out to I went to the doctor and my infusion center, and I didn't go out to lunch or anything, but I had groceries delivered. Basically, I stayed home.
Uh-huh.
But I could, I could sit out on the patio, I could walk in the street, I could do anything I wanted, just could not dig in the dirt, couldn't have sushi, and had to wash all my bananas and avocados.
Uh-huh.
But if I had to make a decision of whether to get up off the bed or the couch or the chair to either go to the bathroom or go get a cup of coffee, I had to make a choice of which one I was going to do before I came back and rested again. I could do one or the other. I could not walk. And it wasn't because I couldn't walk. It was I didn't have the energy to walk.
That sounds familiar. Yeah. Yeah, I can remember. I don't remember what the waiting times were, but at one point I had to stay. I actually recovered at a friend's house because I live alone, and it was just a lot easier to be able to do it with their help being around. God bless them for taking me in. And I don't remember what the waiting period was, but boy, was I thrilled when I could actually like leave the house I was staying in. I remember going to the supermarket, and the people I was staying with were worried about me because I must have spent an hour in the supermarket. I was just walking around so thrilled to just not be around the same four walls all the time.
Right.
First time I went to the supermarket, which was about 5 or 6 weeks after my stem cell transplant, I passed out in the Pepsi aisle. And it was just exhaustion. At least they had a stack of Pepsi cases. So I sat down and I kept trying to get somebody's attention so I could get out of there. And I kept, trying to stay conscious. And, it was like people would look at you like you're crazy. So finally I got somebody, but it was scary. So you have to watch the exhaustion.
Right.
Don't be like me and trying to do too much.
So, I mean, he doesn't, his wife is a physician, so he doesn't take as much advice from me as he does from his wife. But, so you would push him to go someplace else to get the transplant.
Unless Maryland can tell you when they're going to do it, or Johns Hopkins, I'm sorry.
Right.
If they're going to do it another month, then no. But if they're going to hold off for another year, that's
no. I don't think it's going to be a year. I have to say that if you look at the COVID statistics on the web for our area, it's almost down to below, almost what it was at the beginning. It's dropping really fast. So
yeah, but what about the next variant?
Well, we don't know. I mean, we have Omicron. Who knows what's next?
Herb, where are you?
We're in Chevy Chase, Maryland.
Do they not have a special floor just for transplant and things at the hospital?
Well, I think that my understanding is that Hopkins has like a guest house next door where he's
No, I'm,
supposed to
I'm
stay.
talking about in the hospital. Every time I had infusions or whatever, I was on the transplant floor and the stem cell, and that was all that could be on that floor. And you had to have, I mean, they had to have special.
Sure.
You could only have one visitor and that kind of thing.
So Ashley, what was
I was
your
outpatient.
experience?
I was never in the hospital.
Hmm.
I just go in every morning, get, fluids and they do the tests and be back at the condo probably by noon or 1 o'clock. And then go back in the next morning at 7:30.
So Ashley, what was your experience?
So after transplant, I stayed in the hospital for about a month. And then, so I went to Sloan and I couldn't, my parents lived in Staten Island, and depending on traffic, it could take over an hour.
Yeah.
So they wanted me to stay close after transplant. So I moved into a temporary apartment in Manhattan. And I was really excited to leave the hospital, but then I was just miserable, and it wasn't the fault of the apartment. I was just miserable. I was tired, and all of those side effects from the transplant. So I actually ended up having to go back to the hospital because I couldn't keep my pills down. But then eventually I was let out. I do remember needing to wear a mask outside in public, and I hated that. COVID wasn't a thing yet, so nobody was wearing masks, and it was embarrassing at that time. I was bald and definitely looked sick. But yeah, that's what happened. I just remember being tired for actually months. I remember being very tired.
So what was your diagnosis that you needed a transplant?
I had acute lymphoblastic leukemia.
ALL.
Yeah.
Right. So are you still in the city?
It's a long story, but I am in Staten Island.
Yeah, when my wife worked at Memorial at Sloan, she had to commute 1 hour and 3/4 each way each day.
Yeah.
So
it's
because we lived
and
in
that's
New
probably
Jersey.
without traffic.
No, she took the train. We lived in New Jersey.
Oh, okay. Got it.
So it wasn't it's not, I mean, unless you live on the Upper East Side, it's not an easy place to get to.
Right.
But and you're doing fine now?
Yeah, I'm doing fine now. I'm just dealing with, I guess, the mental side effects, emotional side effects. Trying to get my walking better, but yeah, I'm doing over well, pretty much fine.
Certainly you got your hair back and it looks great.
Thank you. Yes, it is a lot.
Yes, I was bald for a while
At least
too.
yours came back in thick. Mine came back in thin.
Mine was always thick, so it kind of came back the same.
Mine was kinky curly and came back curly and then went straight in 6 months.
Yeah, so my hair is straight and it came back curly, and I thought, this is fabulous. I really have, a nice Jewish curly hair. And then all of a sudden it went straight again.
Yeah.
So no luck. But that's the way it goes. But I mean, it's good that it came back.
I was going to say, the best thing is it came back.
Right.
Right.
I mean, taste buds went away too, and that came back.
Unfortunately, my taste buds were always there. We were talking about weight earlier. I am within 3 pounds of what I was the day I went in to get my stem cell transplant, and 3 years later, I am still within 3 pounds of that same weight.
Mhm.
I can't lose it, and I try hard not to gain it.
Right.
I took a lot of prednisone and that really
Yeah.
got me.
Yep.
Gained a lot of
Right.
weight because of that.
Right. It'll do it.
Yep, it will.
I was on 60 mgs. I ended up with bleo-toxicity, so I had pulmonary toxicity from the ABVD that I had for the Hodgkins, and I was on 60 mgs of pred for almost 6 months.
That's like an industrial strength prednisone.
Yep. And so they gave me that, and then they gave me Ativan. I'm like, why are you giving me Ativan now? I've already finished treatment. And they said, because you're not going to sleep because you're on 60 mgs of pred. But I gained 35 pounds in the first 2 weeks I was on it. Yep. Took me a year to get it back off again.
Yeah, I remember waking up at like 4 o'clock in the morning, ravenously hungry and eating a box of cereal immediately.
Yep. I couldn't go out to the grocery store without bringing a little snack bag with us.
So anybody else have anything to share with us tonight?
I have a question. I'm sorry, I'm on an iPad and I can only see like 6 of you at a time. It's weird. I can't get all of you on. So, Jim, I'm talking to a ghost. I mean, I know you're here and I can see certain people. Jim, just let me ask you, what's your background that you know so much about everything? Because I'm pretty new to this Facebook account. I mean, not this Facebook, this meeting.
Let me tell you a little hit, because I'm on an iPad too. If you'll go and hit the little camera and it says webcam preview, there's a thing that says view webcams, all, talking, and none. And if you'll put it on talking, you can see who's talking.
Yeah, I don't know. Mine doesn't. What is put all
Hit
view
the camera.
Yeah.
Yeah, when it says, then go to hit the talking. And then you can see who's talking. That's how I could see other people than the 6 that came up.
Okay, thank you so much. So, Jim, what is your background?
The background, anyway, Air Force for 23 years, IT, and then anyway, I was a government.
No, I mean with your cancer. How do you know so much?
In the cancer wise, AnCan helps a bunch, because I mean the folks who are there know a heck of a lot, and it's a sort of like the thing I happen to liken it to is then a graduate school in it, because I mean it is amazing the amount of things they discuss. Okay, the treatment wise, there is about 40, well actually about 38 to 40 of us there, okay, every week. And there are guys in the various stages of it, okay, the various drugs, the trials, etc., etc.
Lynn,
So,
he's talking about prostate cancer. He does not have a blood cancer.
well, actually, technically speaking, and with the VA, okay, happened to classify me also having a non-Hodgkin's lymphoma, because okay, it was discovered within the lymphatic system. And I believe it's all through it at his point. So that's how come I'm actually here and there.
Okay. Because I have CLL. I'm active in where I live in a suburb of New York City, and I'm on the executive committee of the Leukemia Lymphoma Society up here for Light the Night. And I participate in a lot of Facebook groups to get information. But one of the things that I'm having an issue with is I'm still in wait and watch, but I'm a very high risk CLL patient because of my bad biogenetic markers. And I have two doctors. My dad was a doctor and I was pre-med, so I kind of like to have two doctors on board. And I have two CLL specialists that are world renowned who differ in the way they want to treat me.
Oh, great.
Who do you have?
Excuse me?
Who are your doctors?
So
Who are your doctors?
In New York City at Weill Cornell, I have Dr. Richard Furman, who I love, wonderful doctor, and he's like one of the gurus of CLL. And then I go up to Dana-Farber in Boston every 6 months, and I have Dr. Jennifer Brown, who is also one of the gurus, and they know each other.
Oh,
you know,
yeah, I like her.
Yeah, and they know each other very well. Dr. Furman admits that he's very different than a lot of the other CLL specialists, which he is. You know, and he's been pushing treatment with me since day one, even though I didn't have any indication.
Lynn, let me just come in a second, because you should know that Catherine has CLL and she's being treated at Dana-Farber. I just want to tell you, as you're talking, so you can just with the same doc?
With Brown, right?
I've been seeing her since I was diagnosed in 2013.
Also, a great group to be a part of. If you're not a part of the CLL Society,
I am.
Support groups. They are really good. I've been a member of, so that's very helpful. Catherine, if you're not part of that, I would go to the CLLsociety.org and join one.
Mm-hmm.
And now they're all Zoom, so you can join anywhere in the anywhere. We even have one guy from England.
Yeah, it's really great. So my dilemma isn't that they differ, because it's going to be my decision when to treat. My dilemma now is that I work with children. I've been out of work since the pandemic. I have no immunities from the vaccines, and actually I'm going stir crazy. I raised over $28,000 for LLS, you know, for their Light the Night. I do a lot of volunteer work via home, but I have a lot of opportunities now to get back in the, you know, workforce and be with children, which is what I love to do. And I would mask up naturally, you know, because this pandemic to me is just going to keep going, you know, and I just
What
don't know
about
how
taking the Evusheld?
Excuse me?
Can you not get one of your doctors to prescribe the Evusheld for you?
You know what? I really haven't pushed it because I'm on wait and watch. And I feel that I really want to let Evusheld go for people who are really sick, more sicker than me. We have very limited doses up here. And I don't want to take away a dose.
I think within the next couple of weeks, they will have a lot more.
I agree with you. I think
They're
there's,
only about 1.2 million doses.
Yeah.
That's it.
Yeah.
About 700,000 initially,
So,
and they just got another 500,000. That's it. There's over 7 million immunocompromised people eligible for it. And up here in the Northeast, it's
Right.
just, I got it, Lynn, a couple of weeks ago at Dana, but I've been on active treatment for a year, and that's one of the criteria before they'll give it. You have to be on active treatment. You have to get your antibodies tested, all of that kind of stuff. For the priority list.
Yeah,
75% of the
Yeah.
patients there are eligible, and they have enough for less than 1%.
I know.
So-
And that's why I don't want to take, I don't want to, well, first of all, I don't want to even ask for it. Okay. Because I think other people certainly need it more than me. Do you live up in Boston? I'm just
I do.
curious, Catherine.
I do. I'm in there every
Do
couple
you
of
live
weeks.
near
So,
there?
about with the traffic, it takes me about an hour to get there.
I have a question.
Sure.
Okay.
Even in being in California, I happen to read the New York Times as well. I'm not a complete hippie, but anyway, has anybody read the article on the New York Times about CAR T being a cure for CLL?
Yes.
Yeah,
Uh,
yeah.
They just had a thing on NBC
Yes.
yesterday that they posted that a guy had it 10 years ago and he's considered cured
Right.
because he's never had any since then. Just was
Yeah.
posted yesterday on, I think it was NBC News or something.
Right, but it
CNN
was,
had
well,
it.
there's
CNN.
also Brian Kaufman, who's head of the CLL Society, had it, but he's saying now that even though I think he's about 5 years into it, that he's having some a little bit of problem with it, but he's done really well on it so far. But they haven't declared it a cure. There's not enough people that's had it
Nope.
to say
Right.
that for sure.
Well, and the other
It's just like
gentleman,
FCR for some people works well for many, many years.
and the
Now,
other
Herb,
gentleman that started,
Herb,
yes,
do you just want to take a quick word to explain what CAR T is for the people who are on the call that we're using a lot of acronyms today, and you all have different blood cancers, so it's hard for people to follow you.
Yeah.
So before
CAR
you
T
use
is
an
used in
acronym,
NN too.
just think.
right. Well, CAR
So-
T cells were discovered at NIH, to be honest. That's where they were first initiated by Steve Rosenberg. But they're basically where you take your T cells and you genetically modify them. So that's their, and I forget what the CAR stands for. I should know like this, but I don't.
Diametic.
Yes,
Chimeric
Right.
antigen receptors.
chimeric antigen receptor modified T cells. They put in a new receptor in the T cell so that the T cell can attack your tumor cells. And then the T cells, then they inject back into you. And
B
they
cell.
go after B cells, sorry. They go back into you and attack the
And
tumor.
if you're wondering why Herb said it happened to be discovered in NIH, it's because he actually is an NIH scientist and he runs a lab at NIH, but for something other than cancer. So that was that's why he referenced
My
NIH.
plug,
When
my
they were
plug
first
for
done,
NIH.
When they were first done, there were 4 people that had it, and I think only 2 people survived it because they attacked so quickly. There was lots of problems with it, and so they've learned to manage it a little better.
Right. I mean, what
And there's
happened was
also
initially,
an NK cell that's been used besides
Cytokine
the CAR
release.
T.
right. So you get anytime you start fooling around with the T cells or your immune system, there's a chance of what's called cytokine storm. And that's what happened a lot before they knew how to handle it with CAR Ts. And that caused a lot of problems. But now they basically pre-treat so that they don't see a lot of cytokine storm. And this can happen. I mean, there are all these other therapies which are immune therapies. I mean, I don't know if you talk about these things called bispecific T cell engagers. They're also coming along as therapies.
Right.
And they work by connecting T cells with other cells to kill cancer cells. And they can also trigger a cytokine storm. So you got to be careful. I mean, one of the things, you know, we all know we're learning. There's no way you can, it's hard to avoid making a mistake. I mean, so for example, yesterday I heard a talk by a person named Catherine High. I don't know if anybody ever heard of her. She is a hematologist working on genetic engineering. And she was at Penn, but she started a company, and now her company has the first approved genetically engineered drug for an eye disease. But the very first person who got a genetically engineered concept died at Penn, a kid named Jesse Gelsinger, where they tried to cure his immune deficiency. And they, you know, but unfortunately, there's some risk with new drugs, but that's the only way we're going to learn about what's going on and how to move ahead.
That's why clinical trials are so very, very important for all of us.
Yeah. You know, I just want to say, I don't think Herb will mind my sharing this, that Herb right now is undergoing a really interesting type of immune therapy that in many ways is similar to CAR T, but it's a therapy for prostate cancer, and preceded CAR T and got approved long before CAR T got approved. But essentially, they're taking Herb's cells out of Herb's body, not T cells, but dendritic cells, and they're treating those dendritic cells, and then they're putting them back into him. So he goes in on one day, and they take out his blood with leukapheresis, and they separate it, and then they send the white cells off, the dendritic cells off, and they come back 2 days later and they get infused back into him. And Herb's done the first of 3 treatments of that, right?
Right.
Is that so?
Right.
There's so much going
So,
on,
I
and
mean,
whilst I understand.
I mean,
Right.
my prediction is ultimately immunotherapy, and it may not be soon enough for some of us, but it may be. Immunotherapy will ultimately cure every cancer.
Yep.
I think we're getting to that point where, I mean, right now, immunotherapy can kill a lot of cancer cells, but the issue with a lot of T-cell CAR T therapies is this thing called exhaustion. They sort of run out of gas. And so they're solving all these problems. Why do they run out of gas? Well, they're going to fix that. How do you prevent? There are tumors which are, the first success is blood tumors. So you guys are in good shape in terms of the future there. But solid tumors are the tough ones because they are very immune deficient. They don't like immune cells to invade them. And so the other part of solving the immune system, the CAR T problem, is how do you get what's called a cold tumor to become hot to let T cells in? But I think we're going. I have to be optimistic. As a scientist for my whole life, trying to cure spinal cord injury, I have to be optimistic even in that area.
I think the bispecifics with the new bites and the attacking CD38 or CD138, to me, is even as exciting or more exciting than CAR T, because you're not involving the T cells, so you avoid the T cell exhaustion, and it can be redone. It's not a one and done thing. If it's needed again, you can do it. And you can also get different receptors. And so if you're not working on CD38, you can go to P53 and have a receptor for that. So I'm very excited about BITE.
Right, bites are important. I mean, there is an article that bites can, in fact, have their own problem, Sally. If you give them too many, you can trigger an immune response against the bite. You can start producing antibodies in your body. So
I have an anti-bite.
Right. So I mean, the biology is really smart, and cancer cells are really smart. So they want to evade detection and evade killing. So we have to be smarter.
Oh, Herbert, I
Now,
have a
you
question.
talk about how smart the cancer cells are. I watched a SpaceX launch yesterday from my patio, and
Whoa,
yeah, but it was 60 miles away. I mean, I saw it go up, but the amazing thing is I saw it come back down and land on the landing pad.
Right.
And just to think, in my 75 years on Earth, a little more than that, we've come from before Sputnik, and now we're launching satellites and technical stuff up in the air and bringing the rockets back so they can be used next week. And we have, our cells in our body are just as smart as our brains. So they've, you've got to think about it that way. I mean, all these things are so amazing, and it's scary.
So
Rick, you wanted to
I have a question about blood cancers and solid tumors. If a blood cancer metastasizes to tissue, either soft or bone, is the blood cancer tumor in the bone, does then that become resistant to the T cells like a solid tumor cancer would?
Not in multiple myeloma, but they also use radiation for it because of the concentration.
I don't think so, but I'm not sure.
A plasmacytoma in multiple myeloma is still subject to the same drugs, the immunosuppressive drugs that we use, but they add radiation because of the tight concentration of those cells. That's all I know.
When I had the Hodgkins, I had stage 4. I had it in all of my organs. It was in my spine. It was everywhere, basically. And I just did the regular ABVD for Hodgkins, and it was all gone within 3 months.
Wow.
Yeah, and I had it, when I had it in my leg.
All of it was gone. I was in complete remission.
Catherine, what's
in 3 months.
ABD?
So what treatment did you have?
So I had the, oh God, now I'm never going to remember it. The bleomycin I remember because I ended up, the last 3 I had to stop it because I got the lung toxicity from that. The vancomycin, the doxorubicin, and the red devil, and the bleomycin. So it was a combo of the 4 drugs, which is generally what they use to treat the Hodgkins. But when I was diagnosed stage 4, so I had it in my spleen, in my liver. It was in my spine. It was in my hip. It was, in the nodes, everywhere.
So are you in remission now?
Oh, I've been in remission for that for 5 years now.
Great.
Oh, wow.
That's
4
great.
years, actually. Since 2008. I did 6 rounds of that. It was every 2 weeks. So it was 12 cycles for 6 months. And 3 months in, I had my scans, my PET scans, and it was in complete remission at that point. And it's never come back since then.
Congratulations.
Yeah, that's great.
Everywhere.
Wow. Miracles.
Right?
Yeah, really.
No,
that
I
was
think
Lynn,
let me get
Lynn,
another
what
call.
CLL do you have?
Excuse me?
What CLL do you have?
What CLL do I
Yeah,
have?
like
Unmutated?
trisomy. I mean, like 13 or 11 or 12.
Oh, I have all of the bad ones. 17P, TP53, Notch 1.
Okay.
It just goes on and on. But,
well, I've been hearing things on that one to go ahead and do treatment earlier on the 17P.
Furman wanted to start a long time ago, and I'm still this is 3 years into it. There's no data. Dr. Brown said there's really no data showing that early treatment can control like Richter's transformation.
Right.
But Dr. Brown just doesn't want to go with it yet. She does not feel there's enough data, and Furman feels there may not be enough data, but he feels that the wait and watch criteria that was done in the 70s is now an antiquated system because of all the new medications that are out there that were not available in the 70s. But Dana-Farber says we don't have any data showing that. So, and he will admit to me, he's wonderful. He will admit to me that if I go to any other doctor, he knows I'm seeing Dr. Brown, any other New York doctor, Dr. Madow, Dr. Lamano, whoever, that they would not agree with him. He's kind of sailing the ship a lot by himself, but I do hear on other webinars, that there are other doctors that are believing in earlier treatment.
Yeah.
But
So, Lynn, I have all those high genetics as well. I had the T53, 53, 17P and all that.
Yeah.
And I was diagnosed in 2013 and I didn't start treatment for CLL till last year.
Yeah, and Dr. Brown is like, okay.
And the only reason we started at that point is because I said, I'm just really tired of being tired. I had been anemic for a while, but it wasn't even necessarily related to the CLL. I had Hodgkin's, I had Richter's way before I started treatment. That's how I ended up with the Hodgkin's.
You had Richter. God, what, you are like a modern day miracle woman. No, I'm serious. Like
Dr. Brown, she saved my ass all of these years, no matter what. That's what I always feel like. No matter what, I know that I'm covered.
Wow.
If you have confidence in the people that are treating you, that's the way I feel, that you know what, they'll get you through it.
Yeah, I guess, well, I'll look at you and I'll use you as my my
Message
mantra.
me anytime. I just posted my email on there. Just
Oh,
anytime.
Thank you.
Lynn,
I don't know where. Yes.
I have CLL also and am watching weight, but I thought the whole reason behind delaying the treating is that because it isn't curable and they don't want you to put you on medication that you would be in remission for, who knows, if you hit remission at all. And that they want to make sure that there's drugs available to be able to continue to treat you. And if they treat you too early,
then you run out of options when you relapse.
No, I know. It's a very interesting, between both of them. I'm keeping both on board because I live in New York. Obviously, it's easier for me to get to Dr. Furman in Manhattan than it is to get to be treated up at Boston, which is about over 3 hours. But I see her every 6 months, and when push comes to shove, I'm going to take her recommendations. I want to go back to work because I can't sit in this house anymore. I really do. And the kids that, I have so many job opportunities. The kids are vaccinated, but of course they're kids. I was a teacher, they're kids. So they're out there playing sports and, doing what children are doing. And, I just can't sit home anymore. I'm really starting to go crazy. I can't do this. My mind is turning to jello and I want to be with other people.
Lynn, does Freeman give you the opportunity to talk to other patients that have similar markers that you have that are being treated by him?
I have 3 other friends that I met on Facebook who he is their doctor.
Okay, and they're being treated.
They're being treated. I'm, maybe because I was pre-med and my dad's a doctor and I'm a little holistic. I do believe in medicine, believe me, and I believe when the time is right, we each know our bodies. Like I told my doctor, I know my body better than he does. I've lived in it for much longer time. But, it's interesting when you get different opinions, from 2 world specialists. And now I may buck both of them because I may go back out and work. and take my chances. And if I get COVID, Dr. Furman did tell me that every patient of his that was triple vaccinated who had CLL and got COVID, none of them wound up in the hospital. None of them, except for maybe 2 or 3 who were really, really sick. Even if you have no immunities, even if they had no immunities, nobody wound up, thank God, in the hospital or on ventilators. So that's the good news for us. You know, not
Lynn,
that we
So
all
are you
get
taking
COVID.
are you taking the 4th shot?
I got 3 of them. He wants me to get a 4th. I read up in Israel. Israel did it, and there was no data showing that that 4th shot did much.
Yeah, that's what my doctor doesn't want me to take the 4th one. He wants me to take the Evusheld.
Yeah.
So we
I'm not
talked
eligible.
about that before you got on in the group, Lynn, about the studies in Israel and that. Sally, go ahead.
Oh, I was just going to ask Al, since he's the outlier of all the blood cancer groups, how does all this affect your treatments and your drugs? The new immunotherapies?
The COVID shot?
No, the immunotherapies for the disease itself.
Well, I'm just on Hydrea, so I really
Right,
don't know.
So that's the only one you're on?
Yes.
I didn't know that.
Yeah, that's the
Oh, is
only
that
one
working?
I'm on. Yes, my numbers have been stable. My phlebotomies have gone further and further apart. So the last one I had was like
Fantastic.
6 months ago, where there was about 3 or 4 months where I had to have them once a month. So
I remember
yeah.
that, and you look so much better.
Thank you.
I
Yeah,
hope you
thank you.
feel as good as you look.
Well, when I
I
went
got to
in there,
tell you, Sally,
What?
I got to tell you, Sally, I saw him in the flesh on Sunday night. He looked like $1 million on Sunday night. He did.
well,
You know,
like I was,
he looked like the guy. He looked like the guy from the beer commercial, from that Dos Equis commercial.
yeah.
But Lynn, what
So,
about Lynn, it seems to me if you got your antibody, your Evusheld, you might be able to go back.
But I'm not on treatment. I'm not on treatment. Yeah, not on treatment. And mentally, mentally, this is just really getting to me. I have to be, let me just tell you also, I lost my 3rd child. She passed away 2 weeks before I was diagnosed with CLL in 2019. So, that was another thing. So I think I couldn't even grieve because I went from grieving her to being diagnosed with leukemia. And I just feel it's like enough already. I just got to get out there because I just feel now, I really hope this was going to end. But, the more I keep reading and listening, there are so many different variants keep coming out every other week, every other month. Like, am I ever going to get out? And I'm not the kind of person that just does well with webinars. I love kids. That's my life. And I want to go back to working with them. I miss it. I lost all my jobs when the pandemic hit. Marissa had just passed away. She was 26. And she passed away. And then I lost all my jobs. I was working with 4 families with their kids. I loved it. And, I haven't worked with them since the pandemic, and I just miss it terribly. The joy that they bring me is like immeasurable. Like when you love what you do, it's not a job. And this is really.
I have a question for you, Lynn, but I just want to say one thing about Al's disease, because there are people on there who may have no idea what polycythemia vera is. And that's when you make too many red blood cells. So there are some diseases some blood diseases you make too many white, and some blood diseases you make too many platelets. I forget the name of the cancer there's too many platelets, and Al has the one where you make too many red cells, and that's why he had to get phlebotomies every so often.
Yeah.
Because the drugs didn't control it, and so they literally have to bleed you to get the blood. So they have to take you up. Al, how much when they did those phlebotomies, how much blood did they take from you?
Like a pregnant bag.
Hmm.
I don't know the ounces or the milligrams, but it was a big, I guess it's about the amount if you go donate blood, like a bag like that.
Like a liter, right?
Oh God, the last time I saw it, I mean, I don't even look at the needle going in my arm. I hate that. I can't even look at the bag, but when she was done and I just glanced over, I go, oh my God, I said, I drank about 4 bottles of water right after that, you know.
Hey, Al, was it red at least? Was the color the right color?
Yeah, no, it's red, but they are, yeah, my bone marrow mutates too many of the platelets and white blood cells.
Hmm.
I've had one doctor tell me white blood cells. I've had another doctor tell me red blood cells, but I know I do create too many platelets. And back to the question earlier, and this is referring to Lynn, what she was telling her doctor. She knows her body more than the doctor knows, or better. When I had my once a year appointment with my doctor up at Mayo, and she walked in and she says, you know, looking at your numbers are nearly as perfect. She says they're nearly normal. I said, well, I wish I could feel that way, you know, because I was still feeling, I still have symptoms of fatigue and nausea, you know, dizziness, lightheadedness, and just no energy really to do anything. And it comes at spurts. I had an appointment with one yesterday, the nurse practitioner from Mayo, and like I was telling her, it's a roller coaster ride for me. You know, 2 or 3 hours I'm fine, 2 or 3 hours I'm down. It's a tough call. You can't schedule, you can't plan anything.
Right. So Rick, are we over time?
I have a question for Lynn. You know that guy that isn't really a fiance that gave you that nice looking ring for your birthday? Is he still around? What does he say to you?
I drive him insane. I do drive him insane. Yeah. You know what? He lost his wife. He was married 36 years. He lost his wife to cancer. His luck, he gets me now. We've been together 7 years. You know, he just can't keep up with me because I'm just like a roller coaster, you know, like vacillating what I want to do, what I don't want to do, whatever. You know, but isn't everybody else, are other people getting tired of just sitting in?
Absolutely.
We all are.
Yeah.
I'm hardly allowed to go to work.
You are or you're not?
I go in maybe once every several weeks.
Mm-hmm.
And that's about it. And it's been that way almost 2 years, and it's ridiculous.
It is. I haven't worked in 2 years. And I teach also.
Okay. Isn't it so
I teach
tough?
third-year college students, and I can't be around them right now because of the pandemic.
Oh.
And I also work in a veterinary hospital doing surgery and anesthesia on the pets. And there's 200 people in the hospital. I can't be around them either. So I haven't worked either of my jobs in 2 years.
And I'm with the SPCA up here in New York, 25 years.
Oh, awesome.
And I have 2 rescues sitting on my couch looking at me. Yeah, I feel like, I hate to say it, but I feel like I'm starting now to lose it. I really, I can't help it. I really just have had enough. And I don't want to whine.
The last question I want to ask everybody then is, and we'll just go around. What tips do you have to stop losing it? Since you can't get out, Sally can't get out of the house, Herb can't get out of the house. Lynn can't get out. Catherine can't. Nobody can get out of the house. I want to ask each of you in turn, and then we'll close up. I want to ask each of you in turn, and we'll come to Lynn last because she's clearly got the biggest problem of the lot from what she does. What tips can you offer if you can't get out the house? Who wants to start? Anybody? Anybody want to put their hand up to start? Or am I going to have to pick on somebody?
Sally's hand is
Sally
up.
wants to start.
I'm waving
Go
my
ahead,
hand.
Sally. Go
Get
ahead.
involved. Get involved with something. I got involved and became a myeloma coach. I'm now writing articles for a couple of magazines for the Association of Nurse Navigators. I am helping Health Tree write articles on the procedures and what you need to know for a stem cell transplant. And we got that one done about 3 months ago, and it'll be published in Health Tree soon. Get involved with your church. I get involved with Zoom meetings, and we have, choir meetings or, youth group meetings on Zoom. Just get involved and get out of your head. Get out of yourself. Even if you can't go out, get out and do it. Research your own
Fantastic.
disease, if you want to do that, but get out of your head. That's all I have to say.
Okay. Who wants to go next? Okay, go ahead, Catherine. Thank you.
Lynn, I totally get it because I'm a people person too. And so what I've been doing is, I worked since last spring all the way through into when it got to be the coldest part of winter. I took outdoor classes at the Y because, I like to go out and I like to work out every day. Gets me feeling much better and I have to see people. So we would do groups outside. They would do at the Y, socially distanced outside. I also live on a lake, so we have a boat. We stay outside a lot. We have people come over, a small circle of people that, I've been in contact with basically the whole time. They'll come over, hang out for a while, that type of thing, always outside. I just find that when it gets to be in this type of the winter and stuff like that, it gets really tough. It's too cold outside. There's no outdoor classes. I just emailed my nurse practitioner today and I said, I got the Evusheld now. Do you think I can maybe go back to the Y for my personal training twice a week? And, it's tough. I totally get it. But I try and stay active outside and keep my circle really small for people. I'm at Dana-Farber every couple of weeks. So, they become more like my family. I've seen more of them in the last year than I have my own family. And I get, and I can totally relate to you with your daughter, and I'm so sorry about that because I lost my sister right at the beginning of COVID. She was one of the first people that actually died from COVID.
I'm so sorry.
2 years ago.
Sorry.
2 years ago next month. So it was kind of the same thing. You couldn't really grieve because, we couldn't be around people. We were fortunate that we got to do her funeral anyhow, but the week after her funeral was when everything shut down in the state of Massachusetts. And that was 2 years ago. So I'm really sorry, and I can totally relate.
Thank you.
Well, Catherine, I think I'm going to have to come visit you with my skull and row on your lake.
Absolutely.
Okay?
We were ice skating a couple of weeks ago.
Well, it's going to be a bit hard to row the skull on when it's frozen over, but I better wait. And I've got an awful long way to come. It's going to be about, what's that?
I got water on 3 sides, so.
Oh, nice.
And I can row around your house. Jim Marshall, what do you do to occupy yourself?
Well, anyway, I am a volunteer, at a military thrift store that we get all kinds of things, and I then I bring things home, to fix, repair, in the garage. Otherwise, anyway, I am out generally every day, on the bicycle, for an hour or so, and plus, anyway, I then happen to research things, and plus also the thing is I talk to people about the disease. Okay, I've talked to probably close to 400 people, okay, attempting to interest them in the testing process. Surprisingly, about 90% of the men I talk to do not want to know. They don't want to know anything about it, and they absolutely refuse, which is amazing to me, but I still keep trying.
Good job. Good job.
Good.
Anne Marie, what are you doing to keep yourself occupied?
Well, I'm not sure I ever really had it to begin with, but I guess the timing of when all this went down for me helped because I just had recently retired. So needless to say, I had a whole list of things that I wanted to catch up on, which I'm forced to be in the house now all the time, which I'm really not so good at that though. I'm very much, I function better in a structured environment. My doctor still says I can't go to a gym. I get that. I'm used to exercising every day. I don't do it as well as home as when I'm in that type of environment. I have kept my pool of people to a small number of people, the people that I know that are vaccinated and are following the rules. You know, I'm still able to see my 2 grandchildren. I read a lot. So I'm basically still in catch-up mode. I do go out occasionally if I feel that it's a safe environment and wear my mask. But I'm amazed at the people that still are walking around without masks. It just blows it really does. It blows my mind.
Where do
So,
you live, Anne Marie? Where do you live?
I'm in suburban Philadelphia.
Oh, okay.
The one thing I haven't done, and these groups are wonderful, but I have not made it my whole life. This is not what defines me. And, you know, reading some of the posts and I see what some people are going through and how they feel, it makes me feel bad for them. But at the same time, I think, well, what's wrong with me? Why aren't I, you know, like obsessing over my next doctor's appointment? Well, that's not going to do me any good because it's not going to change the results. So why worry about something that I can't control? You know, I have faith in my doctors. You know,
That's the old Dr. Google, and I would not recommend people getting involved in researching their disease unless they have a very strong mentality where they can keep things separate. That they read them, as I've said to Herb, you read it as a scientist, you don't read it as a consumer. Because if you read it as a consumer, it can make you very crazy. Seth, what do you do, man?
You know, I'm not, by the way, I'm not drinking the pickle juice that people say I should be drinking. You know, there's some like crazy recommendations that you read out there.
Wait. Pickle juice actually works.
What? What? What's it going to do?
For cramps in your legs.
It helps cramp. If you get cramps at night, you take a slug of pickle juice, your cramps will go away.
Yes.
Oh, they're not
Absolutely.
This is helping CLL. You know,
no, this is pickle juice is for cramps, muscle cramps.
Yeah.
Works for hangovers too.
Oh well.
Pickle juice with gin and tonic. I could drink. With gin and tonic.
Many years ago, I used to drink it.
I'm gonna have to cut that theory out. I'll just have to have a few one of these nights, and then.
I think you're
That's
digesting and you're
cramps.
looking for
If you have
stuff.
cramps in your legs.
We want you, Catherine, we want you back next month, okay? I'm just saying.
I'll report on the pickle
What
juice.
about Seth? Let's make some room for Seth. Seth, what do you do?
I really don't have any advice that I can offer except for getting my 2-mile walks in every day. That's as much for mental health as it is for physical health. And I've had a problem with leg cramps at night for a very long time, but I'm doing much better since I shifted doing my stretching to the late evening, closer to bedtime, I suppose. That's
Pickle juice, Seth.
What's that?
Pickle juice.
I hear pickle juice.
Dill pickle juice.
I'm tired of everybody.
Dill pickle juice.
Nothing has helped me. Except I do know that I have to stay hydrated.
Yes.
I usually am anyway, but doing my stretching, like after this, I'll do my stretching. closer to bedtime
You.
seems to be
Good,
effective.
good for you. Judy, I know you do. I know you work with the CLL Society, and that obviously gets you out of the house, not out of the house, but
No,
it
not out of
gets
the
you
house.
to interact with other people.
I live in a retirement community that has an amenity center that's right behind my house with an indoor track that I go and walk on some, and friends that live here. The other thing that I have done is I have flown in the last year. I took 4 trips last year, and we just got back from Tennessee last Wednesday. And when I fly, I double mask and use a face shield, plus wipe everything down on the plane. And I think one of the things that helps is because my husband has to be in a wheelchair, so we get on first, so we're not in with the crowd of getting on, and we stay away from people in the airport. We don't get close to people at all. And because I'm a former teacher, I've been retired since 2005 after 37 years of teaching. And one of the things I am not afraid to say to someone at the airport or whatever, if they don't have their mask on properly, I'm not opposed to saying, I'm very immune compromised. Would you please put your mask on? So,
And that's in Texas, right? Where aren't you?
yes,
Didn't you say you're in Texas? Oh my gosh.
yes,
Good for you.
I'm in Texas.
Good for you.
As a former teacher, I can do it easily.
Good for you. All right, Al, Mr. R, tell us what you're doing to get yourself out that house.
Well, I'm pretty handy around the house, so I've started a couple projects, and well, I'm done with them now. But I redid a shower, I built a big porch in the back, I refinished furniture. I'll strip metal chairs down and paint them with automotive finish. So I refinish a lot of stuff. I do go out, as Rick knows, and he makes fun of me that I go and meet and greet all the Home Depot employees, but I will double mask when I do go out. When I'm around people that I don't know, I do double mask, and I do go out, just put a mask on and get out and stay away from people. But again, we live in the Southwest, so I'm able to go for a nice bike ride from noon to about 2 o'clock.
Oh, wow.
And even if I don't go for a bike ride, I'll take a small drive sometimes, and just
Where do
around
you
the
live?
desert in Tucson.
Okay.
Yeah, we're about
Nice.
2 hours south of Phoenix, Arizona.
Yeah, I know.
And
I've been there.
so the weather's
I used to live in
different,
Tucson.
and yeah, so I just get out and do stuff around the house, whether it's inside or outside. I'm constantly painting something or refinishing something, and they're just little projects just to get me out and keep me going.
Did you lose
Hey,
your job or
Professor.
did you retire, Al?
Yeah, so I was diagnosed in 2020 in January, and that was right after we hit the pandemic and we went into shutdown mode, and it seems like just everything just hit at the same time,
Mm-hmm.
and everything just
Tough.
like fell into place and minus, and just rode the wave as I went. And I think it was in March when I had a bone marrow biopsy, and pretty much that year was shot. But yeah, I've come a long way, and here I am. And again, I do stuff, but like I tell my wife and Rick is that what used to take me a week to do something now it might take me 3 months.
Mhm.
I get it done. You know, I'll work for an hour and take a break for an hour, maybe work for 45 minutes and come in and sit down on the couch for an hour and then get back up and go back out as soon as I get my energy back. But I have to pace myself. I have to know where I'm at. It's like we've talked about this before. It's like when I wake up, I'm a lot better now, but for the last year, it was like when I wake up, there's that fuel gauge and I don't know where that needle's at, whether it's close to empty or if it's full until I get going, and then all of a sudden I crash. I'm done. And it could be like at noon, it could be at 2, it could be sooner. I just don't know. And I just take it little by little. And again, I mean, we've had some cold spells here. So we have a Peloton. I do the scenic routes on that. We have the Wii, so I play tennis on that. I'm trying to get back to, get my energy level back up.
So to answer your question, Al, some of you may have heard of Canyon Ranch, in
yes.
Tucson, and there's one in Lenox. Well, Al was one of the maintenance supervisors there for 25 years, and
Wow.
and then he started working on his own, and then he got sick soon after that. But he had so many jobs on his own, and wasn't feeling well enough to do all the jobs. I mean, he could have been working from COVID started until today with all the people that wanted him to work. So, and Al and I have known each other for several years. Before I moved back to this area, I have a couple of houses here, and Al used to look after the houses for me. He still looks after the houses for me, even though I'm back here. So that's how we got to know and became really good friends. Now, what about you, Professor? What do you do what do you do?
Keep myself occupied. So unfortunately, it's almost every day's like Groundhog Day. I get up in the morning and I do and because it's a little cold, I do stationary bicycle. So that's the first thing that I do. And then I have a daily meeting with people at work who we used to have coffee together. So we still have coffee together for 45 minutes, only it's with Zoom. And then in the afternoon, I generally work as much as I have. I don't have a huge amount of work these days because the lab is small and it's been really restricted since COVID. So that's afternoon. And then 3 times or 4 times a day, I'll talk to Rick. And then there's always the gin and tonic before dinner. And then I found out I did get to go back to something that I didn't do enough of before when I was really busy, much more busy with work, which is reading. You know, I really have enjoyed going back and reading really interesting novels and some nonfiction as well. But I've been reading much, much more than I used to. Oh, and I forgot one thing, Wordle.
Yes, yes.
Yep. So that's my day.
All right. So Lynn, have we given you any ideas?
Yes, and I've done them all. I work out every day. It's, I just did my Pilates. I think it's just that it's winter here in New York. It's so cold and just not, I have to start letting people, I don't see a lot of people, physically. Once the warmer weather hits, it'll be a lot better, but it's just a tough hump right now. It's not like Arizona. I love to go out. My energy level has changed immensely also. I find I used to be like the Energizer Bunny. I can't do that anymore. But I think it's the winter months of the isolation,
Yes.
And I knew it was going to be hard. I didn't, I'm involved with my doctor doesn't want me so involved with everything, just with my disease. He said to me, get a life. Because I do a lot with Gilda's Club and LLS, and I raise funds for both of them. He said, really, I need to get other interests, which I do have, but, you know, and I have 2 other children, so I have 2 dogs, but I miss being out, you know, I miss whatever. I miss the normalcy of life. I do miss it. Like everybody else. I'm no different than anybody else.
Lynn, do
You know,
you
I
like
just think having cancer on top of a pandemic is like a double whammy, because if there was no pandemic, I would be out and about doing everything I could do. You know, I'd be at my gym, which I was at 22 years, which I can't do now. You know, I'd be seeing friends, I'd be whatever, I'd be working. But, you know, between the pandemic and the cancer, that's like a double whammy for all of us. It is, right?
And do you like movies? I mean, also in a cold environment, I got brave enough to go out with a friend to 2 matinees. There was only 6 people in the theater for the first movie, which I felt very comfortable, obviously. Neither movie was crowded if I did it during the week in the afternoon.
Yeah, a couple of my friends told me they're doing that. Right. And like you said, I haven't been to a movie, right, since, you know, so yeah. No, I might start doing that now.
Oh,
The numbers are coming
Lynn.
down.
So, Lynn, you've got
Yes.
until March. I don't know what date. I don't know. I don't have my calendar here, but that first Thursday in March, we're all going to be back here, and I hope all of you will join us. And we are going to ask Lynn if she's been to a movie. We're going to check in and see if she's been to a movie since the meeting, okay? Just remember, listen, we've got to close out this meeting because Herb's getting very tired there. I can see. But this has been a great meeting, and thank you all for coming. You'll get a reminder for the next one. We'll make sure the new people get in.
Right.
Judy will also add you for the prostate cancer meeting, so that reminder will come to you, not your husband, because we don't have his email address. But I'm sure, as the teacher that you are, you can get him into the meeting, and
Well,
we'll see you then.
he's not very tech savvy.
You'll get him March the 3rd, Sally. March the 3rd, right?
Okay. See you all.
Thank you.
Bye, guys.
Good
Thank you.
night.
Good night, all.
Good night, everybody.
Thank you, Rick.
Good night.
Thank
Good
you.
night.
Good night.
Pleasure.
Good night.
Good night.